does that work, Dr. Farmer?
So this is called a fractional CO2 laser. It's called the dot matrix. See, there's dots in there. Each one of these dots goes deep into the skin to tighten the skin. But the area in between, that's where it does the ablation or removing the extra layer of skin. You see how this is charring here? So this layer will be peel off, and then in the meantime it tightens the skin. The heat goes inside or down the reticular dermis or the deeper dermis, and then would tighten that skin.
I was asked if it helps with the pores.
If it has what?
Pores. Like if you have a pore.
Like if it helps with the pores on the face.
Yes. It tightens. Like if somebody has white pores from acne or something like that, it helps tighten. Also, it helps with aging spots, helps with capillaries, any sun damage. Anyway, so what we're saying is, there are certain areas you cannot do the entire skin the same intensity, because every area in the skin, one has a different thickness of the skin. This area here is much thicker, for example, than maybe, the lips, than the chin, than under the eye. The under the eyes, the skin is very, very thin. And then this area here in the forehead, because of the, very close, it's right on bone, you cannot do the same intensity on the bone as you do in the cheeks, for example. The cheeks is padded with a fat pad, so you can always put deeper intensity here, but you cannot do it the same intensity on the forehead. Okay, the lips, you can do this also as deep. All the perioral area you can do deep, because you got nice padding there, and it can tolerate higher intensity or heat. Okay, the neck, for example, that's what I was trying to say. It's very poorly vascular. So if you do a very high intense heat in this area, you can get a lot of scarring, and this scarring is not forgiving. It's hard to deal with the scarring in the neck after you scarred it. Okay. So what we are going to do is just going to go down.
What are you saying about the nasal ali right here?
Yes, this area here, you can easily get necrosis in that area, so that's why you have to be careful with it. So chin up for me, and then we're going to feather what we did here. We're going to feather it down to this area, and then you go down to 35, and then do this, feather it down here, so this way you don't have a line of demarcation between the two zones. CO2 laser, fractional CO2 laser. This is actually the best time in the winter time or the fall to do this procedure, because the weather is not so bad. It's not hot or as hot as the summer, and it's not as humid, so you can recover better. So we always, in October, September, October, we normally do this, more of this procedure. So if you have age spots, if you have an area of acne that has white pores, if you have, fine lines, wrinkles, stuff like that, this would be a good procedure.
And how long is the recovery? Almost?
So the recovery for this is about a couple weeks, but expect your face can be red. The first couple days you're going to be charred. It looks like almost like a piece of steak you put on a grill or something. But then all that skin will be peeled off, and then your face will be red for a couple weeks. We do recommend that you don't go out in the sun for at least 2 months, and at least a couple weeks before you come in and do the procedure. Another thing, this procedure is not for everyone. You have a dark skin. If you are Fitzpatrick, 3, 4, well, 3 maybe, but 4, 5, or 6, this is not procedure for you. So what is Fitzpatrick? We classify the skin grades or the skin tone from 1 to 6. 1 being like albino, very, very white. 2, like European, British, Irish, or something like that. And then 3, Mediterranean, Italian, Greeks, stuff like that. 4, be like more like Middle Eastern skin. And then for Latinos, and it goes up like that. 5 or 6 would be like very dark and black. Okay? So if the reason for that is because any laser that you do can cause hyperpigmentation, and it can work out. Lift your section. Just to the side.
You want me to lift this? What do you want me to lift?
Hold that.
Is that it?
Goes down a little bit. Lower intensity. This is only like 35. So when you see blood like this, that means you reach to the reticular derm, which is like the deeper derm. Yeah, that's the area for tightening. That would help with the tightening. I'm gonna do a little bit here above the eyebrow. Now we're gonna take this off. Close your eyes. Okay, area here.
Beautiful.
Yeah. So if you see an area where it didn't get some, we can just go over it here again.
With the lower setting?
Yep. Because now we're stacking. Okay, we've already done it once. So you're stacking it over. You're not gonna go.
We wouldn't even know.
Yeah, I mean, let's look to here.